Now we have a person coming in to have a discussion with us on healthcare, a very controversial topic in America today. Joining us now is Joe Bruno. Thank you for coming on.
Well, thanks, Jason. Thanks, Connor.
All right, so very controversial topic. What do you think?
Well, I think that in these days and times, there needs to be something done about the healthcare system that we currently have today. I think that people are urging for reform, and they should be, because our system needs to be fixed.
Right.
And the Democrat majority in Congress has proposed universal health care, a single-payer system. They've also proposed a government option. And I believe that having such a system run by the U.S. government would be very unbeneficial for Americans to have.
Right.
I believe that instead, reform that many senators have proposed, such as Senator DeMint from South Carolina, he's proposed a health care plan that would allow for people to buy health care across state lines, which would lower costs, and which I've always thought that there should be a catastrophic insurance program set up by the government, which would insure people who cannot be insured.
Right. Now, Canada has a government-controlled healthcare, but 57% of Canadians report having to wait a month just to see a specialist. And as you can tell, that's a very high percentage, too high. And, you know, if people have a disease that needs to be treated immediately and have to wait a month for it, then that's bad. That's not good.
My parents have visited Prince Edward Island, and they know people who go there frequently, and they have talked to their friends that go there, and they've said that in the middle of the night, the hospital's actually shut down because they don't have the money to pay them, the doctors. So if you were to have a heart attack or some sort of emergency in the middle of the night, you would die flat out. Right. There would be no way for you to get medical attention, and it's one of the things that goes unnoticed by the media of how a socialist healthcare system would work.
Yeah, I mean there are Canadians actually crossing the border just to go to a doctor in America.
Right. It would take 9 months in Toronto for you to get an MRI.
Oh man, see now that 9 months, the person could be dead. That is the problem. That is a big problem. Now, do you think Obama is a socialist or has socialist views?
I think that based on his background, I'm not going to go and call him an extreme Marxist. I'm not going to go and call him a communist, but he has definitely socialist leanings. He's no way a capitalist. I don't believe he supports the free market system. I believe that he is a socialist at heart due to his background at Columbia and Harvard and the indoctrination that goes on at universities. It's unfortunate, but it's true. I'm going to say it. And I believe he wants to put through an agenda that he believes is right. I don't believe he thinks it's wrong, but I believe he thinks it's right, and I don't believe it's the right way to do.
Now, there's been controversy over whether illegal aliens coming to this country will be covered by the health care plan Obama's trying to pass. And that's also bad. That's not a good thing.
Now, I think that it was not the right thing for Congressman Joe Wilson to shout out during congressional address made by President Obama. But I think that he was very angry in doing so. He had a strong feeling about what could happen and what the American people are being misinformed about. There has been actually coverage would be made for illegal immigrants to get health care on this new plan. It's a 1,000-page bill. You can't read the whole bill. So one of the congressmen actually said, "Oh, why would we read the whole bill? I'm just going to sign it anyway." What have we come to in a country where our congressmen don't even read the bills that go into effect?
Exactly right.
And I mean, 12 million illegal immigrants getting covered with the same health care as the rest of the middle class illegal Americans is very unfair. And the middle class is going to get very mad, and that's why they've had those tea parties and the protests in Washington.
What also makes me feel kind of sad is that people who they don't agree with this new plan are being labeled bad names. I'm not going to say these names. I'm not going to try to be controversial, but I feel that it's another way to get this agenda pushed through, and I don't feel it's right. I feel we should be able to have a discussion without their majority pushing everything that they want.
All right, we got to wrap it up now. Thank you very much for coming on.
Thanks for having me.
We respect your views.
Thanks, guys.
No problem.